The decision to move from a medicinal therapy for chronic ear infections to interventional would be ear tubes, the most common procedure we perform on our pediatric patients. It really is a silicone or plastic-based cylinder with a 1 millimeter opening that can be placed onto the eardrum. So the ear tube simply acts as a back door to get that fluid out and allow aeration through the ear canal while the eustachian tube and internal plumbing are still clogged up. Now that procedure is 5 to 10 minutes long, and while it is under general anesthesia, it would be a mask anesthesia, no oral intubation or breathing tube placement. The success rates are extremely high in alleviating the frustrations of those chronic ear infections. A small 2 millimeter incision is created on the front corner of the eardrum to pop that tube into position, through which we can drain the fluid and optimize that aeration of the ear once again. In the long run, ear tubes do naturally fall out. More than 95% of ear tubes will displace themselves at 12 to 15 months after they were put in. Ear tubes will alleviate 95% of ear infections. I recall one of our families having come in. The real key for this family was they had seen their child with great speech development all of a sudden turn around and start to regress. Well, with chronic infections and fluid, we know that children are missing out on about 20 decibels of hearing, and with that, their speech progression can really struggle. Now, ear tube placement is also meant to solve that problem. And to see that family on the postoperative side perk up and see that speech development roll right as we expected was so fascinating and so rewarding to the family as well. If you have any questions on ear infections or ear tubes in your children, please reach out. We'd be happy to help.